press corps press conference this fall, and my 150 provide the status of our regions in the and to we communicate the vaccine is 90% effective after 2 doses, 4 weeks, identical 95% rate clinical trials. Historically, the FDA rules in the direction of these panels, and we expect their endorsement as soon as today. Our own vaccine advisory panel is poised to review all available FDA data. Assuming a favorable outcome, and based upon the federal government's likely delivery schedule, Illinois hospitals can expect their Moderna shipments sometime early next week. This is yet another very, very exciting development, and it reinforces and it brightens the light at the end of the tunnel for all of us who have been fighting through COVID-19. As December comes to a close, and as the deadline to fully allocate our federal CARES funding approaches, I want to provide an overview of where we have invested those dollars to support working families and small businesses, beyond just the reimbursement of expenses for our state response like PPE and setting up testing sites. For much of the last year, we have had to completely revamp the operations of state government in response to this pandemic, with agency staffers working around the clock to figure out new and sometimes very innovative ways to deliver services remotely and to implement new programs to meet enormous needs that were truly impossible to foresee a year ago. Over the summer, in partnership with the General Assembly, I announced a series of programs dedicated to supporting our small businesses and our working families who have been hit hard by the economic impacts of COVID-19, and structuring each with a significant focus on equity, ensuring that disproportionately impacted areas receive their fair share of support. I'm especially proud to say Illinois led the nation in ensuring that our CARES Act dollars went to the front lines of the economic dislocation impacting the lives of the people we serve. We're only the 6th largest state by population, but Illinois launched the largest housing assistance program and the largest small business assistance program in the country. To date, we've awarded $190 million in rental assistance, supporting more than 38,000 renters suffering financial hardship from the pandemic, and $84 million in emergency mortgage funds to help nearly 9,500 homeowners stave off foreclosure. The grants went directly to landlords to pay rent and to mortgage service providers to pay mortgages, which has maximized the number of those dollars in stabilizing our housing market and our communities. When these programs were launched last August, the goal was to assist 40,000 renters and homeowners with $300 million in aid. But with additional coronavirus relief funds from my administration, we extended our reach and assisted even more families across Illinois. By the end of this month, we will have provided $325 million in emergency housing assistance to 54,500 renters and homeowners across the state. Everybody deserves to have a roof over their heads, especially in a pandemic. And I want to thank the Illinois Housing Development Authority for their work to make a difference in the lives of so many people. The final dollars for this program will be out the door by mid-January unless Congress includes the $25 billion in rental assistance that's currently in the bipartisan coronavirus relief package. I'm regularly pushing Congress to give more help to families in Illinois. If additional federal assistance passes the U.S. House and Senate and becomes law, expect additional rounds of emergency rental assistance in the near future to help give relief to those who were unable to previously take part in this critical program. I also directed $90 million in CARES funding for a total of $275 million to increase the number of families eligible to receive emergency assistance for rent, for food, for temporary shelter, utility bills, and other essential services through our low-income home energy assistance program and our community services block grant program. These programs have supported more than 155,000 Illinois families. To families seeking assistance to pay your bills, please visit helpillinoisfamilies.com to learn if you're eligible to submit an application. It's open to all low-income residents regardless of immigration status. And remember, this is a program, not a loan program, it's a grant program. So I really do encourage those in need to apply. And again, you should go to helpillinoisfamilies.com. Small businesses and entrepreneurs are the backbones of our communities and the drivers of our economy. And I know the sacrifices that you've made have been enormous. That's why it's so important to me that you get the support that you need. Our business interruption grants, ranging from $5,000 up to $150,000, have a targeted focus on the small businesses that truly need help. 85% of our grants have gone to businesses with annual revenues of $1 million or less. To date, we've awarded over $214 million in grants to more than 7,500 businesses in Southern Illinois, in Central Illinois, and in Northern Illinois. This funding has been deployed in more than 500 communities to small businesses, including restaurants, retail, event spaces, arts venues, hair salons, museums, and much, much more. Nearly half have gone to businesses in disproportionately impacted areas, recognizing the ways COVID's impact was compounded by civil unrest earlier this year, helping more businesses avoid a dual crisis of recovery. Given the limited funding available and the high volume of applications received, DCEO has closed the latest round of BIG Big grants with the hope that federal support will allow it to reopen applications. The state will continue to focus on reviewing applications that have already been submitted and making additional awards over the next several weeks. We will notify all big applicants who will receive an award by December 30th. And with a separate $270 million of our business interruption grant program dedicated specifically to assisting child care providers, our $540 million small business grant program is the largest in the nation. It operates with a laser-like focus on helping working families, especially working mothers, through this pandemic. Finally, as hard as this pandemic has been on state governments' finances, we know that local governments have suffered mightily by COVID's impact too. $250 million has been focused on reimbursing local governments outside of Cook and the Collar counties that didn't receive direct support from the federal government for their COVID-19 expenditures. Things like overtime pay for first responders or PPE. We have now sent out more than $129 million to over 700 local governments, with another $30 million still in the pipeline. It's not too late to claim costs through this program. The state of Illinois and DCEO continue to urge local governments to take advantage of their allocation and to leave no costs on the table. The program will continue accepting applications for eligible expenses through January 31st. All of these efforts amount to a unique and historic effort in Illinois to mitigate this virus's devastating effects on the health and livelihoods of the residents of this state. While there is so much need that is still unmet and for which we need further support from Congress, Illinois has been a leader in protecting workers and small businesses with our CARES Act dollars. I'm proud to lead a state government that is committed to making a difference wherever we can and with whatever we have. So thank you, and now I'd like to turn it over to our Director of the Department of Public Health, Dr. Ngozi Ezike. Doctor.
Thank you, Governor. Good afternoon, everyone. Happy Friday. It's hard to believe, but there's only one more Friday after this one for this year. As we continue to receive vaccine over the upcoming months, we want to be prepared and identify as many people as possible who can administer the vaccine once it's actually available. Our traditional healthcare partners, such as hospitals, local health departments, and clinics, of course, will be providing vaccinations, but we're also looking at additional healthcare workers who can lend a hand to this large vaccination effort. To that end, I have issued a proclamation modifying the scope of practice for both advanced and intermediate emergency medical technicians. In simple terms, this will allow many EMTs to administer both flu vaccine and COVID-19 vaccine during this pandemic. As we move forward, instead of the current challenge of not having enough vaccine, we hope that there'll be so much vaccine available that we'll need more healthcare workers to actually administer all of the vaccine. As I've said, this vaccine is the beginning of the end of the pandemic, but there's serious distance till we get to the end of the pandemic, but we will get there. Today, 7,377 new Illinoisans were diagnosed with COVID-19 for a total of 886,805 cases total in Illinois. Since yesterday, we've unfortunately received report of 181 individuals who lost their battle with COVID for a total of 15,015 lives lost. In the hospital overnight with COVID were 4,690 individuals, and of those, 1,023 were in the intensive care unit, and 589 were on ventilators. In the last 24 hours, more than 112,000 COVID tests were reported for a total of more than 12.2 million tests since the beginning of the year. Please stay safe and healthy. Please help us get to the end of the end. I know you're tired of me saying it. I'm maybe tiring in saying it as well, but it's the right thing that we all have to do. We need to avoid gatherings, wear our mask, wash our hands, and maintain our distance. Please have a great and safe weekend. Buenas tardes y feliz viernes a todos. Solo tenemos un viernes más de este año después de hoy. Increíble. A medida que continuamos recibiendo la vacuna COVID-19 durante los próximos meses, queremos estar preparados y identificar la máxima cantidad posible de personas que pueden administrar la vacuna una vez que esté disponible. Nuestros socios tradicionales de atención médica, como hospitales, departamentos de salud pública y clínicas, administran vacunas, pero también estamos buscando otros trabajadores de salud que pueden ayudar con las vacunas a gran escala. Con ese fin, he emitido una proclamación que modifica el alcance de la práctica para los técnicos médicos de emergencia avanzados y intermedios. Esto permite que los técnicos de emergencias médicas que administren la vacuna contra influenza ahora hagan lo mismo con la vacuna COVID-19 durante esta pandemia. A medida que avanzamos, en lugar de no tener suficiente vacuna, esperamos que haya tanta vacuna disponible que necesitemos más trabajadores de salud para administrar la vacuna. Como he dicho, esta vacuna es el principio del fin de la pandemia, pero no hemos llegado al final. Todavía hay un largo camino por recorrer. Se ha diagnosticado el virus de COVID-19 a 7,377 nuevas personas para un total de más de 886,000 casos aquí en Illinois. Desde ayer hemos recibido informes de 181 personas con COVID-19 que han muerto por un total de más de 15,000 vidas perdidas solo aquí en Illinois. 4,690 personas estuvieron en el hospital durante la noche con COVID-19. De ellos, 1,023 pacientes estaban en la unidad de cuidados intensivos y 589 personas estaban en ventiladores. En las últimas 24 horas se han informado más de 112,000 resultados de pruebas de COVID-19, para un total de más de 12,2 millones de pruebas aquí en Illinois. Por favor, manténgase segura y saludable. Evite las reuniones y usa su máscara y tenga un saludable fin de semana. Gracias para su apoyo. And with that, I'll turn it back over to Governor Pritzker.
Thank you very much, Dr. Ezike, and happy to take members of the media, their questions.
Yeah, I just have three questions for you, and one for Dr. Ezike. Now that we're heading away from daily briefings, does that mean that we're heading in the right directions when it comes to cases, hospitalizations, and ICU capacity?
Well, let's be clear, we are, in terms of cases, in terms of hospitalizations, in terms of ICUs, those numbers do seem to be heading in the right direction.
Well, you've asked Illinoisans not to travel this winter break unless necessary. What are your plans with your family, and will you be staying in Illinois?
I'll be staying in Illinois. We have vaccine distribution. We are still undergoing this crisis of the potential surge, and my plans are unchanged from what I did at Thanksgiving.
Okay. Last question for you. Since Regions 6 and 9 should be falling back into Tier 2, they said that they followed the rules, they should be rewarded with more freedoms, and if not, some say that they'll lose trust in you. Why do you keep moving the goalposts? Because they work so hard to be sure that they could try and open up restaurants and bars.
Well, first of all, we're very glad that things are moving in the right direction. We're also concerned the numbers have not come down as precipitously as we would have liked to have seen by now, and so that's of great concern to us. We're still seeing 7,000, 8,000, 9,000 cases every day, and we still have a positivity rate that's far from the WHO recommended 5%. Having said that, it's certainly our intention as we get through these holidays to begin to look at, without having holidays ahead, right after the new year, to get to reducing the tiers for various of our regions. But very much appreciate that everybody, remember the reward here ultimately is we have fewer people getting sick and fewer people dying, and we of course want to allow businesses to do more as soon as we possibly can.
Okay. Dr. Ezike, can I ask you two quick questions? And this comes from one of our listeners. Does the vaccine contain aborted fetal tissue? And should those with strong religious convictions against using aborted fetuses to develop vaccines take or be forced to take the vaccine?
There are no aborted fetal cells or fetal tissue in the vaccine. There are no microchips, and there are no preservatives in this vaccine.
What about DNA? Some people think that their DNA is going to be altered if they take this.
There's no DNA. that's in this. This is an mRNA virus. This is an mRNA vaccine. There is no virus in this vaccine either.
All right, we're going to go online. And just for awareness, moving from Tier 3 to Tier 2 does not open bars and restaurants, so we're all
No.
aware. You can find those
That's true. Thank you.
tiers online. Jim Haggerty at the Rockford Advocate. Dr. Ezike, can you comment on the misinformation surrounding the COVID-19 vaccine, such as that it causes Bell's palsy or other harmful side effects?
Excuse me, stuck. I'm going to keep this on because it doesn't want to come off. So we have seen, you asked about Bell's palsy and what else?
Just any other harmful side effects?
Yeah, so again, we have the information that's available from the trials that have occurred for the Pfizer vaccine. We're going to know a lot more about the Moderna vaccine as well. I think in terms of Bell's palsy, that is not a recognized known side effect. I think there is a certain amount of Bell's palsy that will happen in the community because it's something that does occur, some very unexpectedly sometimes. And so if it were to occur in the person who had a vaccine, you'd have to try to distinguish whether this is something that could happen as the chance occurrence or if it's related to the vaccine. And so at this point, we don't have that as an established side effect of this vaccine. We will continue to learn more about this virus as more and more individuals, as millions and millions of people get this vaccine.
James Stratton at WREX, I know you just addressed this, but I'll just ask it again. According to the state's website, Region 1 meets all of the requirements to drop from Tier 3 to Tier 2. Why hasn't it dropped to Tier 2, and or when is that coming?
Well, as I said several weeks ago, as we have moved along, since the surge hit us, it's important for us to get the right trajectory of cases and hospitalizations and ICUs, and to make sure that we get to the right level. Remember, there are still many, many hospitals around the state that have limited ability to take in new ICU patients or even new hospitalizations. And so we're trying very hard to bring it down all across the state before we start to relieve the regions from Tier 3 to Tier 2. And once again, to the point made earlier, bars and restaurants would not reopen under Tier 2 from Tier 3. So there's a ways to go. If you go to our website, IDPH's website, you can find all of the metrics that we set out for moving from Tier 3 to Tier 2, Tier 2 to Tier 1, and then back to Phase 4, which will tell you exactly what would open up in each of those tiers.
Charlie Meyerson at ChicagoPublicSquare.com. Can you shed any more light on the reasons for the anticipated shortfalls in the delivery of vaccine to Illinois and other states?
I wish I could shed more light. The federal government has really been mum on this. But as you have seen over the last 48 hours, governors all across the nation have come to terms with the idea, because they've been informed, as I was, that their vaccine distribution would be diminished by virtue of the deliveries from the federal government being diminished. So we still do not know exactly why. I know there's a conversation going on, it seems, as I can see in the press, between Pfizer and the federal government, and maybe a disagreement about it. But what I know is what I have stood up here and told you, and I try to be as communicative as I can about what I learned from the federal government.
Dan Petrella at the Tribune. Dr. Ezike, on Monday you said we'd be able to tell this week whether a post-Thanksgiving surge was coming. The numbers have since trended down. Is it safe to say we have avoided that outcome?
I am really excited. I am really happy to say that we did not see the significant surge that we were very much concerned about in relation to all the reports that we saw of the large amount of travel here in the state of Illinois. And I think people know that in the Midwest generally, while others on the coast are surging, I think we had that a little bit earlier and are on the way down. And I think all the mitigations that we had in place in advance of Thanksgiving have been helpful. So no, we did not see a surge following Thanksgiving. I'm waiting for this final week's tally, which will come on Monday, but so far that is a good thing that we can report.
Dean Olson at the SJR. Have long-term care residents in Illinois started to receive the vaccine? If so, how many and where?
So the plan for our long-term care facilities, we entered into we opted into the federal option to allow Illinois to be part of the pharmacy program, the pharmacy partnership program. And by opting into that program, that gave the CDC, through this partnership with Walgreens and CVS, they will now be our surrogates for vaccinating our long-term care residents. So we're very grateful to have the ability to be part of this partnership. We immediately opted into it. We understand from the federal government, from the CVS, Walgreens groups, that they will start that vaccination program being in the facilities by the week of December 28th. So we signed up and are ready to have that be done. I think the start date when they're actually in the long-term care facilities is the week of December 28th.
Dan Petrella at the Tribune had one more question. Have you decided on a system for people to be able to prove they've been vaccinated?
So with every vaccination, people will be given a card. There's a card which allows to write your name. The provider will write their name, the lot number, the manufacturer, the date you got it, the date that you're supposed to return. So that card is one way. Of course, every single dose that is given will also be entered into the state immunization registry. So that is another way that it can be stored. I was recently talking to my team about stickers and pins and wristbands, but that card is your official document and proof of immunization, so that should be guarded carefully as the primary mode. But providers who have access to the state immunization registry system can also see that information, and in the event that the card is lost, could print out something from the state registry system. But we really would strongly urge you to keep close tabs on that immunization card.
Kelly Bauer at Block Club, looks like she's our last one. Should Illinoisans expect to be under Tier 3 mitigations through January in case of another post-holiday surge?
We're watching closely to see the numbers. We're only at December 18th now. There are 13 days left in the month of December, and so as we watch those numbers, those will have an enormous effect on whether we can bring down the tiers from Tier 3 to Tier 2 and beyond. But that's what we're focused on every day. It's what I have been focused on, making sure that we're heading in the right direction at the right speed. And and I will say that the numbers are better than they were, but need to improve.
Governor Pritzker, do you
Thanks,
know how many
everyone.
people are vaccinated daily? Did you have a guesstimate?
Well, I think today we're up to 17,000. Yesterday we were at 3,500. So it gives you, yeah.